Hello, my Crystal Loves Texas Facebook family. Thank you so much for being patient and thank you for joining us. I am here tonight on our next to the last episode. I'm gonna miss you guys from the Coalition for Barrier Free Living. I'm gonna miss them. We've had them here all month long, and they have been sharing some fantastic insight and some wonderful information um, about how people in the Houston area living with disabilities can find more independence and freedom and the services that they need. And the best thing about it is most of these services that I've heard of almost expressly are free of charge or definitely on a sliding scale so that it can conform with people's incomes. And that's the important part. But with all that said, and I'm always looking at the wrong camera. With all that said, thank you so much for being here. I'm going to let my guests introduce themselves and let you know first that today we are going to be talking about relocation services. Relocation services. And they're going to tell you a little bit about what that is. And then I'm going to also share with you a personal story. So we're going to start to my far right. Go ahead and introduce yourself and let us know what you do for the Houston Center for Independent Living.
My name is Georgia Cox, and I am the Senior Relocation Specialist for the Houston Center for Independent Living.
Okay.
My name is Victor Ward. I am the housing specialist for the Houston Center for Independent Living.
And I got to say this. This is a shameless plug. And Victor, where are you from?
I'm from Liberia.
He's the first person I ever met from Liberia. I had to say that. I had to say that. We were having a whole conversation about that. And my final guest.
I am LaKendria Ross. I'm the Relocation Services Manager.
Okay, very, very good. And of course, we can only see the top of her head, but we won't worry about that. I'm going to take for granted that when she comes in, there she is. There's her full head. And of course, there is Rebecca Williams, always our trusted co-host here.
Hi.
Hey, Rebecca, how are you?
I'm good. How are you?
Oh, we can't hear her. Oh, let me take her out until she kind of gets set up there. Okay, we'll bring her back in just a second. Let's see if she's ready. Hey, Rebecca. Oh, nope, not quite yet. Okay, I'm gonna wait till that stops moving. Okay, so relocation services. Last week, when your colleagues were here, I thought they were going to be talking, when they were talking about independent living, I thought that was the same as relocation services. So tell me what the difference is.
Well, relocation services is a service that provides a type of independent living.
Okay.
What we actually do is we work with managed care organizations that are covered through Medicaid.
Okay.
And we actually help nursing home facility members move out of the nursing home back into the community to start or continue an independent way of life.
That's awesome. That's really awesome. And when I saw that, when Miss Frankie sent that over to me today, I said, this is unbelievable, because I know sometimes, and this certainly is not indicative of all nursing home facilities, but sometimes we hear horror stories, and the ones that make it to the news, and not just nursing homes, but my gosh, sometimes group homes and things. You hear there have got to be dozens and dozens out there doing the right thing, but the ones that you hear about in the news, that's right. But one of the first things that I want to touch on, LaKendria, tonight is, let me try to bring Rebecca back in. There she is. She's still now. Okay. Rebecca, can you hear us?
I can. Can you hear me?
Can't hear her. We can't hear her. But anyway, we're gonna see if don't touch it. Don't touch it. We're gonna try to get you in just a second. Okay. Yeah. Stay right there. Just don't touch it. Okay. Anyway, what I want you to do first is tell us about what that transition generally looks like. So, scenario: we have an individual who was in an accident and who may now need the services of, at least in a temporary way, even if temporary sometimes means a matter of a few years. Okay. They have always been an independent person, but they, at this point, are going to need some assistance. and not just independent, but accustomed to living alone.
Okay.
So, and I know that those are some special circumstances that you guys have got to navigate through sometimes. What would that person do who is at this point coming out of a rehab or coming out of a nursing home facility, and they want to establish some semblance of the independence they had before?
Well, it kind of starts with the resources that they have available to them at the time. For someone that's going through rehab, our services are provided to them in a way to where we do commit to helping them find ways to get back to their independent living.
Right.
But it's always case by case scenarios.
Okay.
So I mean, it would be a little bit more information that we need. What type of insurance they have.
Okay.
What is the foreseen problem that they have from where they were once independent to what they now need assistance with.
Right. Well, let me give you a scenario.
Okay.
I'm a teacher, and I work with another teacher who was who a few years ago had a stroke. Now that teacher is able to teach perfectly fine. However, this person is now in a wheelchair. So, and as far as being able to get to and from, someone has to bring this teacher to and from school, get the teacher into the building, and this kind of thing. So, if in a scenario like that where someone is very much wanting to express as much independence as possible, what would those steps look like?
Well, it would begin with what is the school doing to provide amenities for them to be able to be mobile in the school.
Okay.
It starts there. Are they able to access ramps to get into the building?
Yes.
Are their doors wide enough in the classroom where they teach where their wheelchair can fit through?
Right.
And is there enough space and accessibility in the classroom to where if she has to be able to navigate to a student to do something closer or one-on-one with them?
Right.
It's those things that we have to consider first.
Okay. So when you're considering that, let's say all of those variables have been met.
Okay.
And this person is working at a job full-time as a teacher, but now the struggle is, or the challenge is, being able to have the type of housing that's necessary so that they are able to maneuver as independently as possible. What would someone like that be relegated to be in a group facility, or would they be relegated to be in a, can they pretty much go back to their homes if they live in an individual home?
Oh yeah, absolutely. That's what we advocate for.
Okay.
Well, first we have to find out what the desire is.
Okay.
If they want to be in their own home, or if they want to be in the atmosphere to where they need more assistance, to where a group home or even assisted living or a personal care home can do those things and amenities for them.
Okay.
So that's what we need to find, and that's what we target. What our program is known as is Money Follows the Person program.
Wow.
And that's why we're contracted with the managed care organizations. Although we do focus in that program specifically with individuals that are wanting to get out of institutions. And when I say institutions, that means nursing homes, personal care homes, group homes, and assisted living.
Yes.
If they show the desire that they want to get out of those type of environments, we advocate for what they want to do, and then we find out what those resources are through their insurance.
Yes.
A lot of people don't know, and they don't understand that it's a lot of things you can do in your insurance if you just call and find out, and you have a good relationship with your PCP, your personal care physician.
Okay.
And when you start to ask these questions and acclimate to trying to change your life to going into an independent, you'll be so surprised what resources and what information may pop up that may not have even been considered.
Wow.
And even Georgia can attest to this.
Yeah.
I mean, she can share some of the information as far as talking to our consumers, those that were either born totally with a disability, or they coming from a environment to where they were once able to do a lot for themselves and can't anymore.
Well, let me ask you this, because just a minute ago, you named about 4 different types of levels of independence that a person can have with independent living? You said group home, and what was the other ones?
Group home, personal care homes,
Okay.
and assisted living.
Okay, so distinguish those for me, or can someone distinguish those?
Okay, so under the relocation services,
Right.
We, as LaKendra stated, we work with the managed care organizations.
And managed care meaning what?
There are
Nurse. What is that?
Managed care organizations. They manage the individual's Medicaid in the community.
Okay. Okay.
There's United Healthcare, Molina Healthcare, Amira Group, and Superior.
Now, what's different from just when you hear that, people, the reason I might understand exactly what you're saying, but I know somebody's gonna say, well, is that just my insurance? Okay, so tell me what that is.
So anytime an individual is in a nursing home and they've qualified for Medicaid, long-term Medicaid,
okay,
they have to choose a managed care organization to manage their Medicaid.
And they can choose that?
Yes, it's their choice.
Wow.
Depending on what their needs are.
Yeah.
All of the managed care organizations offer the same basic services.
Okay.
But depending on individual need,
right,
this person might need more therapy services, where they might go with this MCO versus another MCO.
Managed care organization.
Right.
That's the MCO. Gotcha.
And that's why it's important that they do their homework, because not each managed care organization give the same exact benefits. So that's why it's important that you can actually access that information online through your Texas Health and Human Services, where there can be a comparison that you do with the type of different Medicaids, because someone with a different disability compared to another may not need the services that United Healthcare provides, but Molina may be more beneficial to them.
Now, I want to add a little caveat to what you all just said, because it's very, very important. So if someone is an older person and not very computer savvy, if there's someone who may have a limitation as far as vision or some other type of incapacitation that would render them not able to be their own advocate, it's very important that people have an advocate.
Yes, it is.
And if people do not have a relative or family member, how would they go about getting someone to advocate for them? Or is that one of the services that can be provided by the coalition?
Yeah, it absolutely is. I mean, that's what we're here for.
Okay.
Of course, there are many people that don't have the support systems like everyone else.
Right.
And it's unfortunate because a lot of times we're not talking about these things. So even if you're in a doctor's office, our providers, they don't know about all of these resource centers like us.
No, stop.
Yeah,
you would think that they
do, but they
that.
do not. Just doing care with my father, when I talked to his personal care physician, when she found out about the organization, now she's referring individuals, her patients, to our organization when it's things that they're needing. And we're just one of the 5 core services that we cover. Relocation services actually falls under the transition core that we talk about. So although we may focus in on nursing home transitions, that's not the only one. That's why we also have our homeless program as well too. And that's where Victor covers those areas for individuals that are homeless with a disability and between the ages of 18 to 62.
Okay. Interesting. I'm going to come back to that because that's something that people don't consider a lot. The homeless population who may have a disability, and we see them.
Yes, we do.
And the thing about it is, when we see this, of course, the ones that we see that are most visible are the ones that are out on the street who may not have a leg, or who may have a prosthesis, or maybe without a prosthesis, or in a wheelchair, and they are panhandling or something like that. And of course, that's a situation that makes your heart just go out and go, oh my gosh, I wonder if, why this person is, and the first thing that we think of is, oh man, there need to be some services. Why don't these people have services? Not knowing that there are services for people if people know how to maneuver to get to those services. Let's go back to this. Those 3 different types of living accommodations that you all can provide. Can you tell me step by step, what is each one of those? Assisted living, what's that?
Okay, so an assisted living is a step, I would say a step up from the nursing home.
Okay.
Individuals that usually go to assisted livings, they need minimal assistance,
Okay.
meaning they can dress themselves, they
Okay.
can feed themselves.
Mhm.
They might have to have some type of support with medication management, of
Right.
course.
Okay.
And then there's personal care homes.
Okay.
Personal care homes are typically for individuals that need more care.
I thought it was the absolute opposite. That's interesting. Okay.
And also, it's important to know there are different types of these personal care homes. There's a type A, a type B, and a type C.
Okay.
And
Hold that thought. Hold that thought. Hold that thought, LaKendra. Okay.
Yeah.
Yeah, we can finally hear Rebecca.
Okay.
Yay. Hey, Rebecca.
Hey.
We can finally hear. Are you hearing all this?
Yes, I am.
Wow. Okay. And that third type. So we've got the assisted living, we've got the personal care, and what's the other one? I think that you said that a personal assistant comes into what's it?
The group
The group.
home.
So what's it? Tell us about
Well,
that.
I mean, each of these three types of homes, they're in a group facility. So
Okay.
that means they're not living alone. There
Okay.
are other residents of the
There.
same demeanor of how they do their ADLs, those
Okay.
are daily activities
Okay.
of life.
Okay.
So that's why I emphasize the three types, meaning A, B, and C, because
Okay.
even assisted living, like Miss Georgia shared,
Right.
they may be able to do some things on their own, but there are assisted livings that can be considered a type B. And what I need to explain is the type. So
Okay.
type A, those are the individuals that can get out of bed on their own.
Okay.
Type B, those individuals cannot.
Right.
And then type C, those are where you have to assist them with everything as far as, you know,
Okay.
they're really just able to wake up. You have to feed them, you have to bathe them, you have to get them out of bed. There's nothing they can do for themselves.
And those, but they may be mentally completely competent.
Yes.
Okay.
Yes.
That's what I was wondering about,
Mhm.
because and when I started teaching in a life skills classroom, and we had many students who were fine, but they had severe cerebral palsy and this type of thing, and we had to change them, and we had to help them with every aspect, but they could do other types of activities. I remember one young lady was a genius in math, but she just had the physical limitations. But so what you're telling me is that, and I'm going to throw this one to Victor, because what you all are telling me is that there can be an independent living facility for someone who needs 100%, well, 95% assistance with their physical day-to-day activities. There are facilities.
Yes.
Wow.
Yes. And it all takes
That's
just
awesome.
research. And that's why you will contact the Coalition for Barrier-Free Living, and
Right.
specifically with us being at the Houston office.
Yes.
Not everyone may need that, but at the same time, it's available to them. Now, another way to find this information,
Right.
using your resources online. Of course, if
Yes.
they don't have those accessibilities, but going on the website, it's always important that you want to find something that's licensed. And that's where you was talking about those
Check
stores.
one, licensed. Yes.
You want to go with somewhere that's licensed.
Okay.
Like you talk about those places that we hear the horror stories.
Yes.
Yeah, they are
Yes.
licensed, but then some of those group homes and personal care homes where you hear about the 15 people in one room,
Right.
those are usually your locations that you're hearing about on the news.
But the thing is, if that is the case, Rebecca, can you hear us?
Yeah,
Okay.
I can hear very well.
Oh, okay. If that is the case, then their license, where's the oversight? Who's regulating
the state.
places like that? And how often are visits made?
Well, in the state of Texas, for a personal care home or an assisted living, initially you don't have to be licensed to get started, unfortunately. It's when the licensing standards are As long as you stay under a certain number, which is 4,
Mm-hmm.
you do not have to be licensed.
And you can
But-
still accept the benefits that this person has from the
Not-
government.
No.
Oh,
No.
okay.
The individuals that go to unlicensed facilities or residential homes
Right.
that's operating as
Right.
personal care homes or assisted livings, they're paying out of pocket.
Wow, I didn't. Wow.
Yeah,
Okay.
they're paying out of pocket, and then
Wait. Did I hear that right? They paying out of pocket to stay in an unlicensed facility?
yeah, that's
Yes.
possible. But then also,
How does that happen, ladies and gentlemen?
But
How does it happen?
one other thing I want to throw out there,
Yeah.
even with them being unlicensed and they're paying out of pocket,
Right.
these personal care homes or group homes, they're still tapping into their benefits through their insurance.
That's what I was wondering.
Yeah, because when you have your insurance card and you call that 1-800 number on the back, they're trying to get information to get some additional attending care, to have
Right.
someone come out. So just because they're housing you there, that doesn't mean they're giving you 100% of all
Of
their
your
benefits. They're
Right.
tapping into your insurance to find out what's accessible to you, and they're finding out, oh, this individual has management for medication, so I can call and let them know that they're housed here at my home and that we need someone to come out here to do medicine management with them, or they need some extra attendant care, or even go to the point to where they apply for respite because the oversight at the home needs some time to do whatever and they can't tend to them, and they use their benefits.
So what you're
Oh,
saying is many times what's going on is very unscrupulous.
Yes.
It's okay. Now, so the first way, guys, to circumvent that is to make sure that your facility is licensed through the state of Texas.
Yes.
And unfortunately,
What else can you do? Yes.
The way that the state has it set up is because initially you don't have to be licensed. You actually have to have residents to be licensed.
Yes.
Okay.
It's when you hit that number 4 that you're supposed to finish and complete the licensing process.
Mhm.
But some don't. They just continue
And grow and
have
grow.
people in houses like sardines.
So
And, you know,
when that's the case, and someone has, let's say that my relative has gone into one of these facilities, and I go over pretty regularly, and I'm seeing things that I don't like. So if I'm at that place, is that the time when I can go ahead and pick up my phone and call the Houston Center for Independent Living? And do I make a report? Do I at that point ask for your assistance in helping me get my loved one moved? Do you have to have a contract with these people to stay there a certain amount of time? Can they force you to stay there against your will?
Well, for any quality of care issues or concerns that you have regarding a loved one or anybody that's living anywhere, regardless
Right.
if it's an unlicensed place or even the nursing home, you can
Yes.
always call the state and make a complaint.
Mhm.
There are people and agencies in place to follow up and investigate those complaints.
Mhm.
But again, if you have a relative or a friend that's in that type of situation, yes, you can definitely call us, and we can do our best to try to assist and direct you to finding a new place or
Yes.
accessing whatever benefit person might have available.
And the facilities that you all are affiliated with, those are going to be very well vetted.
Yeah, those are all, actually, each managed care organization already has a list of approved and contracted licensed homes that we assist their consumers with figuring out which one they want to go to.
Mhm.
And have you all, this is just out of curiosity, have you all, or do you all regularly go and just do drop-in visits at these homes, or do they encourage that or discourage that?
We do.
Yeah,
Yeah.
we do. Yeah.
Yeah, I was gonna say y'all don't seem like y'all are y'all not gonna leave it stone unturned, which is good.
And
Which is
especially
good.
if it's somewhere where we referring, we
Yes.
always think of it as this is our loved one.
That's right.
So
That's right.
if I wouldn't want to put my loved one there, I'm definitely not going to put one of my consumers there.
Okay.
And there has been an instance where I've, done one of those visits.
You didn't like what you saw.
I did not, and I actually was invited. So that's the thing I didn't understand. I was invited to view this home, and they said they was up to par. And when I got there, they were still trying to put a hot water heater in. So it's people living there, and I'm not.
No.
So yeah,
You had to turn it in. You had to report it.
Yeah, and I told them, unfortunately, I won't be referring anyone to this facility
Right.
until you come to park.
Yes.
And then honestly, what they don't realize is not to be malicious to them, because with this line of work that we do and the various places that we've been and that we've seen, we're a good contact for them to know, to let them know, like, hey, I understand you're trying to do this, but these are some things that you should consider try to get into state regulation, or this will be more beneficial.
Right.
So again, we're not trying to hurt these organizations and these other places that are trying to help people, but we just want to make sure that the quality of care is sufficient to take care of them.
And I like, you made a statement and it made so much sense. You said, when we go out to do a visit at one of our facilities that we've recommended, we look at it from the standpoint of, if I had to have one of my parents or a loved one in this facility, would I be okay with what I saw?
Right. And that's why we go back to our phrase, my home, my choice.
Yes.
Because our consumers, they choose where they want to live. What makes them comfortable, just because it may not be suitable for us, if that's what they desire, that's what we advocate for.
So tell me, a person.
Crystal, can I ask this question real quick?
Sure.
Because I think I missed it on the onset.
Yeah.
So, because I've had this conversation with my parents, they said if anything happened to them, they would rather be at their own home and just have help there. So do y'all provide those services for people that want to stay in their own homes?
Well, if let's say your mom was in a nursing home, one of the waivers that she would be able to access once she's approved for long-term Medicaid.
Right.
Long-term care Medicaid is what pays for them to live in a nursing home, but that qualifies them for community Medicaid through Star Plus waiver.
Right. And they shouldn't let the phrase long-term Medicaid make them afraid of qualifying for that.
Okay.
The reason that you have to qualify that, because it's been deemed that you need to stay in the nursing facility for quite a long-term period, or for the duration of life.
Right.
But just because they qualify for that doesn't mean they always have to stay there.
Okay, that's good, because that can be depressing for someone.
Yes, because when you hear long-term, you already automatically hear, I don't want to be here forever.
Yes, that's right.
Yes, and they get discouraged. So that's when they find out about our program.
Yes.
And even if it's not them necessarily talking about a nursing home, loved ones, even other individuals that's left the nursing home themselves, they have friends there.
That's right.
So they actually advocate for them, because we get referrals from our old consumers saying, well, my friend is there. Can you help her get out or him get out?
Wow.
And those are, it's just comforting to hear that there's somebody out there that's still concerned about these people.
That's right. Wow.
And under the Medicaid waiver, there are benefits that would assist with taking care of your mom in the home, which are providing services for whatever amount of hours she's approved for.
Okay.
The Medicaid waiver will assist with home modifications to make the home
accessible
if it needs to be. Medical equipment and supplies through Medicaid.
Right.
So, there are a lot of benefits through the waiver program.
Right. And
so if they have Medicare or private insurance, then y'all don't do that for those people?
We can provide
Medicaid. So.
I'm sorry, I missed what she said.
We didn't hear you.
Oh, I was saying, do y'all provide that for people who have insurance and Medicare, or it's just for people who have Medicaid?
Well, the program is driven through Medicaid, but we are a resource center. Just because they may not have Medicaid, we can still give them the same information in order to access it through their Medicare.
Yes.
So, just for example, if you have a parent that's elderly, remember, Medicaid has a lot to do with the type of disability that you have and its income. Now, Medicare
Right.
is more so about an age eligibility, and also is about health too. There's different criterias with those, but the same thing you can do with Medicaid, you can do it through Medicare as well too. But as far as there being a state-driven program to help with that, I mean, that's where some of our knowledge to helping you with those resources. We'll find out more about that because we are so driven with Medicaid, but it's always accessible to you.
Okay.
Asking
Okay.
questions and finding out.
Okay.
Now, interestingly enough, I want to shift over because you brought something up at the very beginning and something that people don't consider all the time, and that is the homeless population. Tell me a little bit about what that looks like, because we all know and we hear that many times the homeless population is difficult to convince to trust services. And many times that could be one of the reasons that they're on the street, just a distrust of what's out there, or maybe mental health deficits that also come into play that are very real.
Yes.
So Victor, that's the population that you work with.
Absolutely.
So that's got to be a challenge in itself.
Well, once you love what you do, it's not a challenge.
Yeah.
So that's why we advocate for them, and that's why we work so hard to give them the help that they need.
Okay.
So people that are homeless on the streets and also disabled,
Yeah.
we have a program for them, which is our homeless program.
Okay.
And that program is just as simple as you calling us and asking us what can we offer and how can we help you and what are the qualifications to get on that program. And the qualification is simple. You just need 6 items to get on there.
What
And
6 items are those?
they'll need like a homeless verification to make sure that they actually are homeless, and to verify that we'll need them to either be in the shelter, have an or the ones that are on the streets.
Yeah.
We can actually go through some program called Hot ID
Okay.
with the cops, and that helps
Okay.
and verify that they're indeed homeless.
Okay.
Yeah.
So some type of way to identify yourself.
Exactly.
Okay. And then what else?
We actually identification as well too. If you don't have an actual identification,
Like a text ID card of some
right, we'll
sort.
ask you to
Okay.
get some kind of a regular ID card.
Right. And that's pretty easy to get.
Yeah.
Right.
And we also work with them with the income. Some of them might be homeless, but they still get SSI or SSDI.
How can you get that if you don't have an address?
Well, sometimes they do have old addresses, or they have relative or some other government official. People have places that they can go to actually access
And
information.
these days, it isn't everything electronic anyway, so that it can just be
And some of them
deposited.
have the phones.
Right.
Yeah.
Yes.
So they can also look on the phones, and they have access to phones. So they can
Okay.
still be able to
So that's
utilize
three things. What else do they need
They
to
need
provide?
a birth certificate.
Oh, Victor, that's going to be hard for some people.
I understand that, and those are some of the
Wow.
challenge we run into.
And
with
that's where
them.
y'all come in, where
Yeah,
you can
we
help
come
them
in and
access some of that.
We give them more resources to help find that, because we cannot actually do that for them, but
Okay.
we provide a lot of resources that can help them.
Okay.
Yeah, and even if we can't provide the resources, there is parts of our department that will still be able to give them resources to help acquire those information.
Okay. So I'm homeless and I have provided these. I have successfully gone to make sure that I've met the criteria for all of the 6 items that you asked for. Now, what are my steps?
After you do that, we still advocate for you. We will actually process your application for you. All you have to do is just sign your application once we send it over to you. And if you cannot sign it over the internet or a
Right.
computer savvy, you can actually come into our location, and we're now open to the public.
Yes.
We was closed for a little while,
Yes.
not closed, but we was just closed from the
Virtual, yeah.
public and virtual. But now you can actually come in, and we can sit down with you and even offer you more help and more service now that we're open and back to the public. We will fill up your application, have you sign it, and we will advocate and submit that for you to the housing department.
Now, realistically,
Yes, ma'am.
Victor, I've had relatives who have been homeless before. Sometimes it's very difficult for them to. Sometimes they don't want to be off the street,
Right.
but we know that many times someone with a disability, they're going to have other medical needs that would really put them in a position for needing to be off the street.
Right.
Yes.
How difficult is it for you to convince someone that's homeless that they need to be where they can have better managed.
Well, believe it or not, Chris, most of the people that come to our organization are those that really want
They're
to
ready.
get off the street.
They're ready.
Yeah.
Yeah.
And even the ones that don't want to be off the street, we actually find ourselves still going out there and we're reaching out to them, letting them know that these services is still available for them.
Yes.
You know, seeing a friendly face makes
Right.
them more encouraged to want to do that. And sometimes when they come into our facility and see that we also work with people that are also disabled in our facility,
Yes.
give them that comfort as well.
Okay.
So we always try to at least encourage them to come in and see what we can do for them as well.
Okay. Well, let me ask all of you this, because there may be a common denominator here for this. What's the mean age of many of the clients that you see? Are these generally younger people? Are they older people? Are they elderly people?
There's mixed demographics.
Really?
Like we
It
can
really
give
is.
ages from 18 up to 62. We have ages
Yeah.
from 30 years old. We got 45 years old. I mean, we have all ages. It's really it's a blessing on what we do over at HCIL, because just
Okay.
knowing helping people even at the age of 18, it's heartbreaking to know that you're only 18, but yet it's still you're homeless and you're
Right.
disabled.
Yes.
And
Yes.
some of these people are just regular people like
Yeah.
you and I that was once mobile and was
Right.
doing everything for
Exactly.
themselves, and
Yeah.
then some forcing circumstance calls them to now be disabled, and
Right.
they feel like because they are that way, society is against them, but
Yeah.
it's not. So there's a lot of options they have with us in the homeless department.
And also in our
Yeah.
nursing homes, it's not always just about the elderly. There are quite a few young
Younger
individuals
people.
that are there as well too,
Wow.
under the age of 18. You may not see
That's
them
true.
as often,
Yeah.
but they do, have the care that they're needing that they can only get in a nursing facility.
Right.
So although we do work with Medicaid in order to help those individuals, Ms. Georgia can share information about some of
Yes.
those agencies that do focus in on children getting out of the nursing facility and going back home with family.
Talk
in order
about
to
that, Miss
receive
Georgia.
their care.
Miss Georgia. Now, some of the things that you all are talking about, and just in conversation, things are coming up that people never
Mhm.
think about.
Yeah.
Tell me a little bit about that. Do you have a big need for that kind of thing? Sometimes a disabled child who the family would like for that child to be back at home.
Oh yes, definitely. So the way that they're serviced, of course, are we keep saying the Medicaid waivers. There are several different Medicaid waivers.
Yes.
There's class,
Right.
like a classroom, but class.
Yes.
And it stands for community living assistance and services,
Okay.
support services. I'm sorry.
Okay.
And that's typically there's no age range, but a lot of younger consumers access that because
Right.
that particular waiver offers more specialized services
Such
for
as.
individuals that have disabilities. Massage therapy,
Yeah.
equine therapy,
Yeah.
equestrian therapy,
All of those things can be accessed.
under the class waiver.
Those are very specialized.
Yes.
Rebecca, while we're doing this, can you look at some of those comments? Let's see. I don't know how, Rebecca. I don't know what happened. I think you bumped out of
Yeah, my phone fell.
Okay, Rebecca, while Miss Georgia is talking about that, can you look at some of those comments, and if any of them we need to address, let us address it. But go ahead, Miss Georgia. Equine therapy. You think of that kind of thing being offered to people that are just wealthier who can afford that kind of
Exactly.
thing.
And
Yes.
people don't know. They don't.
Wow.
Another significant one is what we call a HCS waiver.
Okay.
That stands for Home and Community Based Services.
Okay.
And those are typically individuals, young and old,
Yes.
that go to group homes, licensed group homes.
Right.
They can either go to host homes as well,
Okay.
or sometimes they go to their own apartments under that Medicaid waiver. And that offers a plethora of services for anybody that has an intellectual developmental disability.
And I don't know why this did not come to me. I don't know why. I have a cousin who is my age, who worked for Harris County. I'm sorry, the city of Houston, and was disabled due to an accident. And my cousin now has access. He has his own apartment. He's wheelchair bound because of the accident. He has his own apartment, and it's a very, very nice place. But he's an independent person, but he is in a wheelchair. So he because of his disability, he has access to benefits for that apartment. Now, when a person has a situation like that, is it on a sliding scale that they pay? Do people with a disability automatically qualify for Section 8 or some other type of subsidized housing? Or
I'm glad the camera not on me.
Well, with our program for the individuals that are relocating out of nursing homes,
right?
Victor handles our homeless vouchers.
Yes.
But we do have another set of vouchers for our nursing home individuals
Okay.
that are relocating. And their only qualifying criteria is to be in a nursing home, a personal care home, or an assisted living.
For any amount of time.
For any amount of time.
Wow.
That is licensed.
That is
licensed.
Right.
Yes.
Licensed assisted living and personal care
right.
home.
Right.
We cannot assist them if they're in an unlicensed personal care home or assisted living.
Right.
Okay.
Because that's a relationship that we have built with the Houston Housing Authority.
Okay.
So what they have done with us is they use us as a referral agency through our organization in order to help them advocate and find those populations of individuals that need help.
Okay.
So as you all know, housing has temporarily opened up to the general public for everyone to get on the wait list.
Yes.
But,
just last week, right?
Yes. But for Houston Center for Independent Living in our organization, it is always open because they are in those criteria of what they're having funding for through the Houston Housing Authority. So they are in a nursing facility, and it does not matter their age for them to qualify. But of course, it is determined if their needs can be met by their managed care organization to support them in their own home.
Okay.
And then specifically another set of vouchers, which is for the homeless population, there is an age stipulation where you have to be 18 to 62 with a significant disability and wanting to try to get off the streets and into your own home.
Okay. So all that to say, because there was a lot of information there to say that if someone does have that type of disability and they qualify, they could have their entire rent paid by Medicaid. Or how does that? Is it a slide? Is it a sliding scale? How do they do that?
Yeah, it's a sliding scale. See, the way that well, let's get away from the terminology of Section 8.
Okay,
that's
something different.
Yeah, right? That's a slang that we have adopted from years ago.
For housing subsidy.
Yeah, it's subsidized housing.
Yes.
So more so, it's actually a sliding scale, but it's based off of what they have for income.
Right.
So if they're only getting Social Security benefits, not everyone is getting the same thing because some people did work and some people didn't work. So it varies on the amount monthly.
Okay.
So
Crystal.
Wait a minute, Rebecca.
Crystal.
The housing agency, they use that monthly income to determine how much they will cover on their behalf.
Okay.
Some individuals do have an obligation of what they pay on their rent. And some don't. You can see $0.
Right.
I've seen $7 that they pay for rent. And I've seen somebody who paid $600 for their rent.
Wow.
The zip code of where they want to live is well too.
Oh yeah, that matters.
You know, where one may want to live in a northern, more rural area, but they don't go too rural because there are certain zip codes that these vouchers do cover.
Yes.
And those are considered partial.
Okay.
So when they go out to the Spring and Montgomery County and those type of places, Webster, and Pearland, those are partial zip codes, because they either accept the Houston voucher or they actually accept a Brazoria County voucher or a Montgomery.
That makes sense.
Exactly.
That makes sense.
That's how they determine about their income.
Y'all, that's a lot of information. I see Miss Frankie has got a lot of questions and Kim piped in.
Yeah, oh my God. The chat is like seriously lit up. You have a lot. Okay, so let me try to get to some of these.
Yes.
I don't know if this was discussed or not, but what is the process of moving out of a nursing home? Did we discuss that already?
Not in debt. Yeah. So,
Go ahead.
Okay.
So a person that's in a nursing home, everything starts with a referral.
Okay.
The referral can come from anybody. Most likely it'll come from the social worker,
Okay.
the managed care organizations, or the consumer themselves. They can
Okay.
call and say, hey, my
I'm
name
ready
is
to
Miss
go.
Susie,
Yeah.
and I don't want to be here anymore.
Wow.
Yeah.
Okay.
That's
Wow.
it.
Okay.
Yeah.
And from
Yeah.
there, we follow up with the social worker of that facility,
Okay.
gathering our information that we have to gather.
And
Okay.
getting
And-
consent that we can talk to the social worker on their behalf.
Okay.
'Cause
And that person can give you the consent.
yes.
Yes. Okay.
And then from there, we will determine, or figure out who their managed care organization is.
Mhm.
Okay.
And then we get them involved by sending
Gotcha.
them the referral, because it's a two-part process.
Okay.
Mhm.
We're the community component. The managed care organization is the medical.
Okay.
component.
Gotcha.
We work together. We just have different roles.
Gotcha.
Mhm.
And
Okay.
That's how we get started.
So interesting. Go ahead, Rebecca. We know you.
And then we
Yeah.
have Aunt Paulette asks, is there a time limitation on the insurance coverage? So I don't really, I'm thinking she's asking.
Oh, okay. She's probably talking about when someone moves into a facility. Is there a time limitation? But I think that we established that most of the services that the coalition, that the Houston Center for Independent Living can provide are going to be those ones that are accessed through Medicaid,
Right.
and not private.
Okay.
insurance. Yes.
Okay, and then Kim asked a very good question. Are these resources only for physical disabilities, or would mental disabilities also qualify?
Ooh, that's a good
Any
question, Kim.
disability, a disability does not stop at
Intellectual
physical or yes.
Wow. That's something I didn't even think about that, but that's a good question, Kim. Thank you for asking that. And it looks like Miss Frankie asked, where did that go? Miss Frankie says, what does my home, my way mean? And I think someone touched on
my
that.
home, my
My home, my choice.
Yes.
Yeah. What is that? What does that mean? And basically that means that you do have a say in where you live and how you live.
Right.
Yeah.
Exactly.
You are not at someone else's will.
Mhm.
Yes, absolutely.
And that's what they need to understand. Like, even though with this funded Medicaid program, it's always their choice, because we advocate from Houston Center for Independent Living. If they want to go into their own independent home, or return to a home that they were once in, or go into assisted living, a personal care home, or I want to stay with my girlfriend, I want to stay with my boyfriend, whatever the case may be, we will try our best to advocate to our Medicaid providers to let them know this is where they will have the best quality of life in their opinion.
Yes.
Can you put services in place to meet their needs? So yes, we have these vouchers, but some people may not want their own independent apartment. And what they need to understand that whatever they are most comfortable with, we've moved some individuals into a lot of different places. And I'll give you
Kendra, you gotta qualify that.
Yeah, I'll give you an example. I'll give you an example. Okay, so one of my best stories that I have, I wasn't always the manager. I was actually a case worker as well too.
Okay.
So I started off as a relocation specialist.
Okay.
So I actually was out in the field, going out to the nursing homes and talking to these individuals.
Okay.
And I moved someone to Wharton.
Okay.
And I don't go to Wharton often, but it's quite rural out there.
Very.
Yeah.
Right. It's nothing in Wharton, pretty much. No disrespect to the people from Wharton.
Where there are no street lights.
That's what I was getting ready to say. No lights. Yes.
Yeah. And then I start to see people who do not look like me, and they may not be as welcoming, but this is where they want to call home.
You're so politically correct. I love it. Yes. No, that's true.
But this is where they want to call home.
That's where they felt comfortable.
Exactly.
Yes.
And I work with people of all walks of life.
Absolutely.
If they feel like 3 walls and a piece of a roof is home for them, then if Medicaid can put services in place, they will.
Now, that's a good point that you just made. does Medicaid, it's got to approve these places that you place where you place the individuals. What if Medicaid says, no way?
Let's not say approve. They will allow you to go in places where they can put services in place.
Okay.
Remember, every area doesn't have the same services
Amenities.
available.
That's right.
Yes.
That's
so
right.
If I want to go to Wharton, but I need 18 hours of home health care, and there's no home health care agency out there that can give me 18 hours, that's a reason for them to say
that's
that
what I was getting ready to ask you.
To put
okay, so that would be the reason for a denial. If they don't have the services to give you in the area where you're placed.
Yes, and this is why we encourage community support for our consumers as well too. Everything doesn't have to come through insurance. If you have a relative or a good girlfriend that'll say, I'll come by nightly or 3 nights, and then a uncle will come by and do those things. These are a lot of the scenarios that we present to Medicaid providers to let them know, although you may not have a home healthcare agency here, this is their community support to where someone will be there when they are needed.
Gotcha. Y'all, you guys have got a whole lot of information. That's a whole lot of information. Now, let me ask you this. Before I let you go, I want to touch on a couple of things because it's just important to know, if I am a person who is in a facility right now and I'm looking to or looking at my options as to what possibly is going to be available for me to transition into, that's going to give me more independence, what is the first thing that I would need to do? How would I reach out to you all?
Give us a call
at
713-974-4621.
Okay. Repeat it one more time.
713-974-4621.
Okay. And if they wanted to contact you via the internet, how would they do that? What is your web address?
Our web address is hcil.cc, but it's most beneficial that they give us a call, or they can reach us by email.
Yes, which is what?
My email address is LROSS@hcil.cc. No matter what transition that they're looking for, if it's from being off the streets or coming out of a nursing home or any type of institution, I will get that information and refer them to the right area if it belongs to me, or if it goes to another department where there are resources available. Just because you may call or email me and my department may not cover those services, it will be covered somewhere else in our organization.
So would they use that same telephone number to reach out to either of you?
Yes.
Okay. Now, just a last word. If you could give someone watching Georgia a last word who was thinking about making that call, what would you tell them to give them that last little piece of encouragement that they would need to go ahead and go out on a limb and make that call to gain their independence back?
Just to be courageous and to do it. I mean, it can be a very scary thing. Sometimes our nursing home residents have been in the facilities for years, decades even. And mama's gone, daddy's gone. They don't have any support at all. Some do, but most don't. Especially if they've been in there a long period of time. And they have nothing.
Okay.
Just know that our services, especially, we can assist you with anything that you're going to need.
Okay.
Whether it's finding a place, furnishing the place, getting started at all. There are services out there for you. And there are people out there that are more than willing to help you.
Awesome.
Okay, one quick thing, Crystal, before you go. Miss Frankie says, don't forget to introduce what services will be discussed next week regarding employment and Social Security.
Okay, well, you just made that announcement. I thank you. Thank you. Okay. And Victor, if you could give us, because we got another show getting ready to come in and set up. But Victor, if you could,
homeless population, to let them know that they're not alone as well, that we are there, we are open to help them. If they're afraid for documentations, we can point them in the right directions. And some of them are afraid of the waiting list. our waiting list is a lot shorter. So
And
we
some
can
of
help
them, some of them, Victor, let's be real. Some of them, if they've been out on the street, they may be afraid that you all, that they may have a warrant or something out. You all do not, are y'all contacting law enforcement?
No, we're
You
not.
see?
We don't contact no
They don't.
law
You don't have to
enforcement.
be.
No, we
You
don't
don't
have
have
no
immigration.
reason to
No,
talk to
nothing
them.
like that.
Yes, no law
Nothing like that.
enforcement.
So
No,
nothing is
yeah.
involved like that. This is for the help of the
It's actually to
consumer.
help them in all aspects.
Yes.
Mhm.
If you could give us one last word, LaKendria, to get somebody to make that call who may be sitting on the fence.
You have the right to succeed and you have the right to fail. You don't know which direction you'll go in
Yeah.
until you attempt to call and try.
Absolutely.
Absolutely.
I like that. I
Yeah,
like that.
I love it. I love all of it. But ladies and gentlemen, you have it here. If you have got a loved one, if you are sitting in a situation right now that you want to see something different for your life, pick up the phone and make the call. At the very least, what they can say is, I don't have that information, but let me see if I can find it for you. That's the very least that they can say if you make that call. But you will never know if you don't make that call.
Yeah.
But thank you guys so much for tuning in and joining us this week. We will have a final episode next week. And Rebecca, tell us what's going to be on that episode again that Miss Frankie said.
Social Security and unemployment and employment. I'm sorry, Social Security and
Social
employment.
Security and employment. So tune in next
Not
week.
unemployment. This not the place for that.
Tune in next week, guys, for my Crystal Loves Texas podcast. Thank you so much, Georgia, Victor, LaKendria, and as we always say, Rebecca, we can do
We
it.
can do it.
We'll see you next week.
Bye, guys.